Aloha friends, this is Jane Clement and welcome to On Call, where we talk to our amazing doctors and providers about health, wellness, and everything in between. Today we're going to talk to a urologist about prostate cancer. Let's see who's on call today. Knock knock.
Hey.
Hey docs.
Come on in.
Hey Jade.
Can I bother you for a few minutes?
Yeah,
Yes.
come on in.
Okay, friends, I am very excited today because we are going to be talking to not just one, but two rock star urologists. This is Dr. Jeff Palmgren. He is currently the Chief Medical Officer at Kona Community Hospital, West Hawaii region. Also a urologist, and Dr. Chris Porter. What are you again, Doc? You are a urologic oncologist.
That's
correct. Did I?
Yeah.
Yay. So let's talk about prostate cancer because sadly a lot of men get diagnosed in the later stages. What can you say about that? Like, why is screening very important?
When you mention prostate cancer screening, most men take off running the other way.
That's right.
They're just thinking of something else that's about to happen.
Right.
But honestly, it starts with a simple blood test, the screening,
Right.
which we can talk a little bit about.
Right.
The examination part, the digital rectal exam, may be part of the screening.
Yes.
But really, a simple blood test is all you need to do to get started.
Prostate cancer is a very slow-growing disease, but it affects a large number of men. About 1 in 8 men will subject to get the disease. And you know, there's a lot of people die every year of prostate cancer in the U.S. It's about the size of Safeco Field. That's where the Mariners play. But it's about 30,000 people die a year. So that's a lot of people.
That's a lot. Yes.
So we really have to find the prostate cancers that matter. That's the whole point of screening. So there's a lot of prostate cancers that don't really matter, but there are some that matter that will need to be treated, and we want to catch those as early as we can. So that's the key.
I do know that from our community needs assessment that we found that men in our area and pretty much everybody across the board with cancers tend to present or tend to come to the hospital and find their cancer later. So we diagnose what we call later stage cancer very frequently.
Okay.
Part of finding the cancers is just having the urologists here that can actually make the diagnosis for you.
How old do they have to be to start getting the screening?
Most men we consider starting screening at 55.
55. Okay. And then
With a
55.
family history, we push that earlier.
I see.
So with a brother or a father who may have the disease, we push that up.
So, say they don't get screened, what would be the symptoms?
Unfortunately, prostate cancer usually in the early stages has absolutely no symptoms. And so there's not really anything to look out for. They really need to get that blood test, which is called the PSA. And that is the first trigger usually.
Yeah, it's definitely important. You know, a lot of people come into our clinic saying that they're not feeling any symptoms. So they're saying, why do I need to be checked for prostate cancer? And as Chris said, you know, those prostate cancers, we want to find them early when they aren't having symptoms. If you wait until you're having symptoms from prostate cancer, it's generally not a good prognosis at that point. You know, you're usually advanced cancer by the time you're having symptoms. So getting that test regularly is really the key.
Okay. And is that like an annual test? You have to get an annual test once you start getting the screening?
Not necessarily. So if it's a very low PSA, we can often skip a couple of years before you need the test again.
Okay.
Yeah.
Say, for example, they come in and it's already too late, they've been diagnosed with prostate cancer. So what are their options here?
If the disease hasn't spread, then we call that clinically localized disease, and that can be treated with either radiation locally, or it can be treated in Honolulu or the mainland with removal of the prostate. The key is that just because you get diagnosed with prostate cancer doesn't mean you need treatment.
Okay.
Half the men we diagnose with prostate cancer don't need any treatment, and they can be followed carefully, but followed, and they require no form of treatment at all, just being carefully followed. That's called active surveillance. So we don't always jump straight into treatment. In fact, it's only about half the men that require it.
That's good to know.
And that active surveillance is really important. You know, it doesn't mean that Uncle could go run up Malka and never see a doctor again, right?
Right,
You
right.
do have to come back and see us and make sure that the cancer hasn't progressed. So we do keep a close eye.
Okay. important question, now that they're ready to get screened, where do they go?
The key is they have to talk to their primary care doctor first, and the primary care doctor will go through the risks and benefits of screening with them, and then usually perform the blood test and refer to us, the urologist, here at Lee Health, if they have any abnormalities.
Yeah, and if there are abnormalities, I think the other thing is the next step, which traditionally was a prostate biopsy, a transrectal biopsy, and even that paradigm has shifted a little bit now that we have advanced MRI imaging here on island. So we do have the capability here on island to do an MRI, and we found that a significant number of prostate cancers can actually be detected on MRI. And some guys with a normal MRI may not even need a biopsy at all, even though the PSA is elevated. So at that point, it's definitely important to go talk to a urologist.
And our message to the women in their lives.
Well, that's important. Take your men in to see the doctor and have their prostate cancer screening done.
Yeah, drag them in by the ears if you have to.
That's it for our talk story today. Join us next time to see who's on call. In the meantime, stay healthy, stay happy. Aloha.